In Washington, one of the biggest unions is blasting the president's health care overhaul, complaining that after giving their support to the law, they may not be able to keep their plan, as the president promised they would. The union representing most workers at the IRS sent a letter to Democratic congressional leaders saying, in part, quote, "When you and the president sought our support for the Affordable Care Act, you pledged that if we liked the health plans we have now, we could keep them. Sadly, that promise is under threat." Wendell Goller is live at the White House with more. Hello, Wendell.
Hello, Shannon. Obamacare critics are crying gotcha because the National Treasury Employees Union doesn't want to give up its government health insurance, which is basically the same that members of Congress get from one of the president's private insurance exchanges. Now, actually, the members won't have to, but Michigan Republican Congressman Dave Camp says the fact that they're fighting a bill he proposed that would force them to make the trade shows that the Affordable Care Act insurance won't be as good as it's being made out to be. Republicans who opposed the cost of Obamacare now adding the quality of the insurance coverage to the debate.
The health care debate is a debate that the president's not going to engage in, but he wanted to talk about it again yesterday, even though it's one of the things that's holding back full-time job creation, and everybody knows it.
Forcing government workers to switch plans would break the president's promise that if you like your president insurance, you can keep it. And Obamacare was created to cover people with no insurance or those who can't afford their current plans. It's not clear the president's the target of the Treasury workers' complaint so much as Representative Camp's bill, but some unions have criticized Obamacare, including the Teamsters, the United Food and Commercial Workers, and the United Roofers Union. Still, the president says most Republican proposals to change Obamacare are really aimed at killing it.
If they've got better ideas to make sure every American knows the security of affordable health care, well, share it with the country. You know, repealing Obamacare and slashing our budgets in education and research and infrastructure, that's not an economic plan.
A lot more attention being focused on the Affordable Care Act as the health insurance exchanges set to begin enrolling people in the fall. Shannon?
All right. Wendell, thank you. And joining us now for some reaction, Karl Rove, former senior advisor and deputy chief of staff to President George W. Bush, and a Fox News contributor. Karl, great to see you today.
Nice to see you, Shannon.
All right, what do you make of this? Because we have unions writing letters not only to Harry Reid and Nancy Pelosi saying, you're the top Democrats on the Hill, we need some changes or this is going to kill us. It's going to kill the idea of a 40-hour work week in America, and we may not be able to keep our benefits. Now we have another major union asking employees to write to their congressmen to tell them to fix and change Obamacare. These are the people who back the law.
Yeah. I wrote about this in the Wall Street Journal recently. I was really taken by the letter from the Teamsters, the Food and Commercial Workers, and Unite Here, which is hotel workers. They made several points. One is that the law has perverse incentives in it to limit hourly employees to less than 30 hours a week, because if you're a full-time employee, you're supposedly working 30 hours or more, and you have to be given insurance coverage by your employer. You work less than 30 hours, you don't have to be provided insurance coverage. So a lot of people who hire hourly employees are limiting their hours to 30 hours, particularly in the hospitality and restaurant business. And this is having rippling throughout our entire economy. This year, each month, an average of 21,700 full-time jobs have been created, while 93,000 part-time jobs have been created. So we're having an incentive for companies to only hire part-time. The second point they made is that these unions, by and large, their employees are covered by employers in a nonprofit insurance arrangement. In fact, this is becoming more and more common. 60% now of U.S. workers are now covered by these so-called self-funded programs, which, interestingly enough, that percentage is growing because they are not subject to Obamacare's requirement for all these lavish benefits, or for what's called a community rating, or for a thing called the MLR, medical loss ratio, which is a very complicated thing that insurance plans don't want to try and have to agree to. So there more and more of these companies are moving into these nonprofit insurance, self-funded insurance programs, but they're not eligible for the subsidies given through Obamacare, which makes all of those employers makes it less attractive to have a unionized workforce and makes it less attractive to add people. And finally, despite the fact that these are nonprofit plans, everybody in them is still going to have to pay the new insurance tax that's on every insurance policy. It works out to about 3% tax on every insurance policy. So these union guys wrote a very tough letter to Pelosi and Reid saying this is terrible for us, but their real target was clearly the president. They said, we elected you, we walked the precincts, gave you the money, worked the phone banks, got out the vote, and this is how you reward us.
And quickly, is this a case of having to pass the bill to find out what's in it, and now that people find it, they don't want to take the medicine?
Oh, sure, absolutely. If you'd gone to the unions in advance of this and said, oh, incidentally, as part of the Affordable Care Act, we're going to take these agreements that you've worked out with employers that give you good benefits, and we're going to just totally mess it all up, I doubt that those unions would have been, enthusiastically supporting the passage of Obamacare.
All right, Karl Rove, we read the piece. Thank you for sharing your insights.
You bet.